Hello, it is now 1 p.m. Eastern Standard Time. You have joined the Supported Employment SE Services Incorporating SE into Reentry Planning webinar. Good afternoon. I am Demetrius Thomas, Deputy Program Director at the Council of State Governments CSG Justice Center in the Behavioral Health Division. Thank you for joining today's webinar on Supported Employment SE Services Incorporating SE into Reentry Planning. Today's webinar is funded by the U.S. Department of Justice Bureau of Justice Assistance, BJA, and is done in collaboration with the Policy Research Associates. To give an overview of today's webinar, I will first introduce the speaker. Then there will be a brief overview on the Council of State Governments, CSG Justice Center, and Bureau of Justice Assistance, BJA. After that, there will be a brief overview on PRA, Policy Research Associates. We will then go into a presentation which will include introduction and information from our Justice and Mental Health Collaboration Program, Training and Technical Assistance Highlight, Grantee Highlight, the University of North Carolina at Chapel Hill on its support work, followed by speaker and panelist Q&A. And then finally, there will be a larger discussion portion where you can discuss prompted questions about your supported employment work, followed by a quick closeout. Anytime during the webinar, you can ask a question by clicking the Q&A button at the bottom of your screen and typing your questions. For content-related questions, we will keep a running list and address them at the appropriate Q&A discussion in the webinar. We will do our best to get through as many questions as possible. If you encounter any technical or audio issues, please access the troubleshooting pages that we are now dropping into the chat. You can also chat CSG registration for any additional support. Please understand that there are some technical issues that may not be able to resolve. We are recording the webinar and will post it on our website. Kristen Lupfer is a Vice President and Program Area Director at Policy Research Associates, Inc., PRA, where she provides management and oversight of personal budget and task timelines and is responsible for coordinating and managing all products within her program area. Additionally, Ms. Lupfer is a project director for SAMHSA SSI and SSDI Outreach, Access, and Recovery, commonly referred to as SOAR TA Center, and is a Housing and Urban Development Technical Assistant Point of Contact for Continuums of Care in Region 10. Ms. Lupfer earned her MSW at the Columbia University School of Social Work. Her previous experience includes work as a supported employment specialist and caseworker assisting people with disabilities who were experiencing homelessness in New York City and Atlanta. Next, I'll provide overviews on the mission of CSG Justice Center and BJA. The Council of State Government Justice Center, the Justice Center, is a national nonprofit, nonpartisan organization that combines the power of a membership association representing state officials in all three branches of government, with the expertise of a policy and research team focused on assisting others to attain measurable results. Our staff develops research-driven strategies to increase public safety and strengthen communities. This slide describes a bit more about our work style and how we strive to reflect the Justice Center's core values, which includes a commitment to being independent and nonpartisan in every aspect of our work, providing vigorous, trusted, high-quality analysis, developing practical and innovative solutions informed by data and research, promoting collaboration and building respectful of diverse views and experiences. The goal of the Justice and Mental Health Collaboration Grant Program is to develop collaboration across the criminal justice and behavioral health systems, from law enforcement, pretrial, courts, jails, and community supervision, to learn how to have successful partnerships that increases efficiencies, improve public safety and outcomes for people with mental illness or co-occurring mental illnesses and substance use abuse in the criminal legal system. BJA's mission is to help to make communities safer by strengthening the nation's criminal justice system. Its grants, training, and technical assistance and policy development services provide state, local, and indigenous nations with the cutting-edge tools and best practices they need to reduce violent and drug-related crime, support law enforcement, and to combat victimization. Thanks again for joining today's webinar. I will be back later. Now I'm going to turn it over to Kristen Lufer, who will provide an overview of the Policy Research Associates PRA and to begin the presentation.
All right, thank you so much, Demetrius, for that welcome. And thank you to all of our attendees for joining us today. We're excited to begin this conversation with you. So a little bit about PRA. PRA is a small woman-owned business founded in 1987. We've got a staff of almost 70 researchers, technical experts, and support personnel. And for the past 30 years, PRA has been a national leader in TA and program evaluation related to best practices in behavioral health. And our work really centers around solutions for homelessness and housing, behavioral health services in the criminal and juvenile justice systems, service delivery for co-occurring disorders, services for children, adolescents, families, veterans issues, violence and trauma, and integration of peer perspectives in research, program design, and policy development. And we are just so glad to be working with CSG in this effort that we're pursuing today. Next slide. All right, so we've come to the point in the agenda where we've got the presentation, what you're all here for. So next slide. Why are we focusing on employment? So the ability to find and secure employment, particularly with a livable wage, is one of the most critical aspects to helping people lead safe and healthy lives. But unfortunately, many people who are leaving prison and jail face barriers and stigmas that are associated with their incarceration that prevent them from obtaining employment. And these stigmas are typically heightened when the individuals also have a behavioral health condition. But we know that supported employment can really address these challenges by linking people with specialized services that help them to identify their strengths, access available resources like education, their experience, their networks, and build skills to become competitive candidates and receive job coaching and training. So the barriers and stigmas that people with behavioral health needs face are multi-layered, right? They can include stereotypes and discrimination due to misunderstandings and negative beliefs, such as misconceptions that people with mental illnesses either should be feared, need to be cared for like children, or likely irresponsible. There are stigmas related to employing people who are formerly incarcerated, which could include fear of violence, mistrust, assumed unreliability. And we want to kind of help break through these stigmas, these misconceptions, and spread really real kind of truthful experience about the value in all of the folks that we're working with. And supported employment can help them in those job pursuits. So that's what we'll kind of talk about today. Next slide. So what we know is that people with serious mental illness, or SMI, so we'll use the shorthand today, such as schizophrenia and bipolar disorder, are often employed at much lower rates than the general population. And like we were saying, this is often due to these pervasive public misconceptions that people with SMI are difficult to employ or don't want to work. However, according to an analysis of surveys that were conducted over 2 decades, on average, 2/3 of people with SMI reported that they do want to work. And additionally, there is increasing evidence base of supported employment programs, such as individual placement and support, or IPS, which we'll talk about more today, demonstrating that people with behavioral health conditions who are receiving these services attain and maintain competitive employment at higher rates than individuals who do not. So we know that these services do work, and we know that by the research, and we'll hear from some excellent researchers in just a little bit. Next slide. So you'll notice on this slide that I haven't listed out the myths. So we want you to see over and over again the facts and not to reiterate the myths that are out there. So the fact is that individuals with behavioral health conditions and a history of incarceration can work in competitive employment. Fact, individuals with behavioral health conditions do want to work. And fact, individuals can work while receiving Social Security disability benefits. Next slide. So we know that many people in recovery from behavioral health conditions describe the process of becoming employed as central to their recovery rather than something that they sought out once they reached other milestones. And when we work, the income is absolutely important. And we're talking about the income from this work as something that's so key to stability in individuals' lives. But we also know that work is so much more than income. It helps to define our self-worth and increase our self-confidence, helps create a role for us in the community, creates a connection with others. I can tell you, I love my colleagues and the folks that I get to work with at, all over the country. It adds structure to our daily lives, the reason to kind of get up and get dressed, and a critical step in recovery for so many folks. So it's really important kind of on all aspects of life for someone. Next slide. So supported employment, it's a general term that encompasses a wide array of services to assist people with disabilities and behavioral health conditions in obtaining and maintaining competitive employment. So these are services and supports that can include skill identification and building, job development and placement, job coaching and training, and problem solving for job maintenance, which is really important. So because accessing supported employment services that are customized for people with behavioral health needs is especially important for people who are returning from prison or jail, as these individuals may need more intensive support to really obtain and sustain gainful employment. And so these supportive services are really key. Next slide. And so the good news is that we know that these work, and we talked about the evidence base that we're seeing with the individual placement and support model, which is a model of supported employment. So for decades now, there has been an increasing body of evidence that supported employment is effective for people with disabilities. And one particular implementation of supported employment is the IPS model. And so I've highlighted that here because we're going to be looking at that a little bit later. But the IPS model of supported employment includes 8 kind of key principles to this model. And I will spend just a minute talking through these principles because I think it's really important to see kind of the values that go into the work and the support that's there that really helps to make that impact. So number 1 is a focus on competitive employment. So competitive employment is completely an attainable goal for people with behavioral health conditions, and it should be the focus rather than a sheltered workshop type setting where you're not in the competitive field. Systematic job development means that there are employment specialists who are visiting employers, trying to find the right employers who are looking for the folks that we want to help get hired. A rapid job search means that we're helping job seekers, those people in these services, to get their jobs directly without just trying to do lots of training, lots of preparation activities, all of that we're getting people directly into jobs. For those of you who are familiar with a housing first model of housing individuals who are experiencing homelessness, it's kind of like that. This is like employment first. Let's get people out there in jobs. There's an integration of services with rehabilitation and mental health services and closely integrated with mental health treatment teams so that people have the support and service they need. Personalized benefits counseling and planning is absolutely an essential piece so that people understand how there's going to be an impact on their Social Security benefits, Medicaid benefits, other benefits, and I'll talk a little bit more about that. It's all about client choice and people not being excluded based on readiness or diagnoses or symptoms or other history or legal system involvement, all of that, not excluded for these reasons. Time unlimited supports, meaning that the job supports are individualized to the person and keep going as long as each worker needs and wants those supports. And of course, worker preferences are absolutely key. So services are based on the individual's preferences and choices rather than a provider's judgment for what they might be. All right, next slide. So what I want to discuss next, and what is kind of the focus of kind of thinking about this in your work, is about incorporating supported employment services into reentry planning. And we'll talk about building connections, encouraging work, educating clients, and then checking in on progress. So next slide. Okay, so because we know that supported employment is a specialized in time-intensive service, so we know that reentry providers and JMHCP grantees might not be able to provide the service directly. And so when reentry providers aren't able to add this specialty service to their teams, identifying referral partners is absolutely key to that. And so there's a number of ways that you can find local providers in your community through your Department of Vocational or Rehabilitation Services, through your Veterans Health Administration if you're working with veterans in your program, your state mental health agency, and also through the Social Security Administration's Ticket to Work program, where there are work incentive providers and job supports and other employment network organizations that can be really helpful in this process. Next slide. So a really important role that you can take, it doesn't have to be a referral out, doesn't have to be a connection in the community, is really encouraging work with ongoing conversations about employment. And starting those conversations can be intimidating, knowing kind of what questions to ask people with behavioral health conditions, how to respond in different situations, are really key skills for caseworkers and counselors. And so I'll talk through some kind of resources and guides that have developed in other settings that are totally appropriate to your settings as well, that can help caseworkers really begin these tough but important conversations. And we know that kind of initiating early conversations about work with people in prison or jail can really help to identify work goals, ensure people are receiving accurate information about supported employment and returning to work. And we really think that this can be helpful in facilitating connections to a supported employment agency for that individual. So we'll talk about the employment guide in just a little bit. Next slide. So in start talking about work, our message is just start having the conversations early, have them often. I have this joke that I tell my friends and family, like, vote early, vote often. Well, we know we can only vote once, but begin these conversations early, have them often. Reminding the individual that this is their decision, right? That they are the decider, they're deciding how they want to move forward. But we can be helpful in that process. We can help them weigh pros and cons. We can help make sure that we're providing reassuring and encouraging messages, and making sure that individuals have accurate information about working while applying for and receiving other benefits, including Social Security disability benefits, SSI and SSDI, and other VA benefits. Next slide. All right, so the employment conversation guide that I mentioned, this was developed by the SAMHSA SOAR Technical Assistance Center. And Demetrius mentioned before that in one of my other roles, I'm the director of the SOAR TA Center. And SOAR is focused on helping individuals access Social Security disability benefits. But a big piece of the work that we do is also encouraging employment so that we can maximize income supports. And so we've created some guides to help people kind of have those conversations with people who may have never worked, may have limited work history, may be, concerned about working while receiving benefits, all of that. And what we, heard from caseworkers was, this is hard to have this conversation. We don't know what to ask. What if they say, my family member told me I shouldn't work, or that, it's not going to be good for my symptoms, or I don't have any experience and so I can't get hired, or all I've ever done is serve in the military and I don't know how those skills transfer. And so what we've done with this guide is have some suggested questions, like how can you ask about someone's interest in work, or why they might want to work, or what they might feel about working. And then questions about skills and interests and talents and other experiences, and ideas about kind of future goals and planning. So we've kind of organized this into different sections to have that conversation. It's like, okay, great, I'm asking the question, I'm getting this information, but how do I respond if they say X? So next slide. We created some sample responses. And so when you get those questions, we've provided some, phrasing or resources or information that you could provide based on that response. So one of the first examples on the front page is, I'm only 18, I've never worked, what can I do? And so we've got a response about what to do for a younger person who might need to gain some skills or identify skills that they have from life experience that they can talk about. And the same thing with the military service question I mentioned before. There's sample responses about that, sample responses about how to reply to someone whose family members might be concerned about them trying to work, and symptom management and all of that. So kind of a helpful tool to kind of feel better prepared for how that conversation might go. Next slide. All right, so we'll talk through the problem and then the solution. So unfortunately, people with serious mental illness earn on average a third less than the median income. And these reduced earnings really underscore the importance for people with behavioral health needs to maximize their income through benefits acquisition and competitive employment. And benefits planning is absolutely essential to this work, and it can help encourage people to maximize their income by applying for benefits and also working at a level that supports their needs, and helping to kind of reassure folks that they're not going to lose their hard-earned benefits, their health insurance, but rather gain that benefit of additional income and all of the non-tangible benefits from working. And get right those other important outcomes like social connection and self-esteem. So there are a lot of supports from the Social Security Administration and other programs to help provide information about how individuals can work and increase their income and not lose their benefits, and find out how their benefits will be impacted by working. And what we know is that potential decreases in mainstream benefits are really offset by increases in earned income. So let's go to the resources that we have related to this on the next slide. There are two kind of key resources I want to point out. There are many more, but on the Social Security's website, they have the Red Book, which is a guide to work incentives. And this book, which is available online, has information about all of the work incentive programs that are initiated by the Social Security Administration for people who are receiving SSI or SSDI. Explains how these programs work. It's long, has a lot of great information and reference and details. But if you're like, I'm just getting started, I don't even know where to start, like what's a work incentive? We have created at the TA Center a brief overview of work incentives that just kind of gives you an introduction. Okay, here's what it looks like when someone is working while they're applying for benefits, which is definitely okay. What happens when people are working after they're approved? What happens to their cash benefits? What happens to health insurance? How do they get maintained? What happens to the check amount? All of that can kind of be summarized in an introductory way. So and I noticed we've got the links to some of these resources dropped in the chat, and they're also in the resources section at the end of this presentation as well. But so this overview is nice to kind of get your feet wet with a little bit of the basics, but knowing that there are experts out there who can help to navigate them. But it's good to know some of the basics so that you can help dispel myths when people say, oh, I can't work while I'm applying for benefits, it will mess up my application. No, that's a myth. We can definitely work while applying. My check will stop if I work more than 20 hours. Well, no, actually it's based on how much you're earning, and you have to be earning a lot for it to totally stop. So let's talk through that. So having like a baseline of information and then knowing where to go and connect with your experts is really key here with the benefits planning piece. All right, next slide. Okay, so finally, I think the thing that you all can do in supporting individuals in your programs is to include employment goals and progress in your regular check-ins. So discussing the status of employment goals, having really proactive questions to help kind of maintain momentum or address any barriers that might be coming up to help prevent that job loss. Like, how can we be proactive and on top of things to keep someone in their job if anything's going on? So there's, some sample questions here. Has the individual taken the steps needed to obtain the job? Are there any other additional supports that they might need and able to achieve that goal? If they are working, how is the job going? Is this what they want to be doing? Do they want to look at even more options? Things like that. So keeping that conversation always there is a really big piece of that. All right, so that is the end of my formal presentation. So next slide. And I'm so excited. We've got a lot of time and we want to spend the majority of our time hearing from a grantee highlight. So we're going to hear from folks from the University of North Carolina at Chapel Hill, and I will turn it over to Gary Cuddyback.
Thank you so much, Kristen. And that was terrific. I learned a ton. So thank you for that excellent presentation. So as Kristen said, I am Gary Cuddyback. And when I started this work, I was at the University of North Carolina at Chapel Hill. I'm now actually at Virginia Commonwealth University School of Social Work. So just wanted to put a plug in there. I'm delighted to have the opportunity to talk about some of the work that my team at UNC has been doing. And I want to also give my colleague, Andrea Murray-Lickman, an opportunity to introduce herself. Andrea?
Absolutely. Thank you so much, Gary. And I will second that. It's such a pleasure to be here with you all this afternoon. My name is Andrea Mary Litchman, as Gary said. I'm faculty at the University of North Carolina at Chapel Hill, and I work with the research team at UNC. And on the research team, I have the pleasure of providing the clinical consultations to the specialty mental health probation officers.
Thank you, Andrea, and we'll talk a little bit more about that as we go. Next slide, please. All right, well, I think we covered, there we go. So our focus will really be on that intersection of justice involvement and individuals living with persistent and severe mental illness. And as many on the call will be familiar with, unfortunately, there are lots of individuals with severe mental illness in the criminal justice system, whether it's in jail, prison, or on community supervision. And there are a lot of complex challenges that go along with this. A lot of these individuals, when you look at the interface of justice involvement and mental illness, they have limited resources that are available to them in the community. Then probation officers, and the reason why this is an issue is that if you think about all the folks involved in the criminal justice system who have mental illness, the vast majority of those individuals are on community supervision or probation or parole. So the burden, if you will, or those who are responsible for providing care and treatment and services are often probation officers. And these probation officers often have a minimal training, if any training at all, with respect to how to deal with individuals with severe mental illness. Probation officers often have high caseloads. Often, unfortunately, you see maybe a punishment versus a treatment orientation. And then individuals with severe mental illness who are on probation often face greater difficulty in meeting terms of supervision. They have higher rates of probation violations and recidivism. They have lots of issues, as we all know, comorbid issues of physical health problems, substance use problems, often a lot of undiagnosed and untreated trauma that really, in addition to elevated levels of criminogenic risks that make this a particularly difficult population to serve. So there's all these issues that make individuals with who are in justice involved complex and a challenge for both the criminal justice side as well as the community mental health side and other service sectors. So the graphic here, again, the approximately 7 million people under some type of correctional supervision, the vast majority of those being on community supervision. And best estimates, by far not perfect estimates, but best estimates suggest that anywhere from 16 to about 30% of these individuals in any of these settings have a mental illness. And by mental illness, meaning a severe and persistent mental illness. Okay, next slide. So the work that I've been doing and the work of my team at UNC has really been focused on probationers living with severe and persistent mental illness and improving the outcomes, both criminal justice outcomes and mental health outcomes. And this timeline is here to show just a number of studies, many of them funded by the Department of Justice, which we're grateful for. They've been a terrific partner in the work that we've done to focus on interventions in criminal justice settings that can improve outcomes for folks living with severe mental illness who are on probation. So we've done pilot studies of specialty mental health probation. We had a randomized controlled trial where we also looked at the implementation and outcomes of specialty mental health probation, which I'll talk about in a little bit more detail in just a second. We looked at both the implementation and outcomes in a 2-county pilot study with some additional funding from the Bureau of Justice Assistance programs. We expanded that study to a 6-county randomized controlled trial of specialty mental health probation. We're in the process of analyzing those data now. We've published a couple of papers on the implementation side of that. And then now we're in a study, which we'll talk about more, which is germane to our discussion today, of looking at the implementation and impact of combining IPS or supported employment with specialty mental health probation in 2 counties in North Carolina, Durham and Wake County. Okay, so next slide. So a couple of aspects to our most recent study, and this again is a study of embedding supported employment, individual placement and support within specialty mental health probation. So the first thing that we did, and we just wrapped up data collection regarding the unique challenges of serving justice-involved individuals. And this is a survey of IPS staff and ACT vocational specialists. And this was conducted in 2 states. We did this in North Carolina and Tennessee. And it was an online survey. We did it with Qualtrics. We had both quantitative items and then open-ended items. And basically, we're asking IPS staff as well as ACT vocational specialists their perceptions about the challenges of serving justice-involved consumers. So this is sort of the front end of the study that we're engaged with now, where we're embedding IPS within a specialty mental health setting. So with respect to our survey, our 2-state survey, we had 177 respondents, and you can see some of the demographics of our sample here listed on the slide. A couple things I'll point out. On average, our sample had about 5 years of experience with IPS or ACT vocational services, and just under 12 years of experience working with individuals with severe and persistent mental illnesses. Most of our sample, 68%, has been from IPS staff, and 32% has been with ACT or from respondents from ACT teams. And I do want to note, I'm getting a comment here. These results, we're in the process of analyzing the data and finalizing our study here. So they're not publicly available, but we'll be happy to distribute this through appropriate channels and professional publications when we're done. And we'll have contact information at the end. So if you have any questions about this, please don't hesitate to reach out. Okay, so this was the sample of respondents for our survey. We did this a couple months and we collected these data, I believe it was earlier this year. Next slide, please. So here's just some of the results from our survey, and we had about 40 items in total, plus the open-ended questions. And it was a Likert scale. We asked respondents to respond to different items on a strongly disagree, disagree, neither, agree, or strongly agree response scale. So some quick results here. 93% of our sample, and again, these are IPS staff or ACT vocational specialists, felt comfortable asking their consumers about their justice involvement. 81% suggested that stigma about justice involvement was a barrier to serving these consumers. 81% also suggested and agreed with stigma about mental illness was a barrier to serving these consumers. 78% of our respondents suggested there were more barriers for those consumers who were justice involved versus consumers who did not have justice involvement. 71% of our respondents, and again, these are IPS staff or ACT vocational specialists, were asked by their consumers not to tell about their justice involvement to potential employers. And then 57% of our respondents either agreed or strongly agreed that it was harder to place justice-involved consumers with employment. And then with respect to our open-ended questions, and we did ask respondents to talk about their need for training, additional training on the topic of justice involvement and IPS or ACT consumers. And many of our respondents agreed that there should be cross-training between IPS/ACT and the criminal justice system. So these are just preliminary results from our two-state survey of 177 respondents, which includes both IPS staff and ACT staff. Okay, next slide. So for the last several years, Andrea and myself and others on our team at UNC, we have been developing specialty mental health probation programs in North Carolina. So we're in 15 counties, although we just recently expanded, and we're now in 20 counties in North Carolina. 2 of these counties, as I mentioned, this is where we're doing our study. Both, it's an implementation effectiveness trial of specialty mental health probation combined with IPS. So I believe, next slide. Yes, we'll talk about what specialty mental health probation is, and many of you on the call may have this in your states as well. But specialty mental health probation is basically probation officers who have an exclusively SMI caseload, meaning these are just individuals on probation who have severe and persistent mental illness. They have a reduced caseload of about 40 rather than the traditional 60 or 70 that regular probation officers often have. That's probably even higher in North Carolina now because there's quite a few vacancies. These officers have a problem-solving supervision orientation where they often balance the need for treatment in addition to doing their primary job, which is to protect public safety. They get ongoing training, and then they also have a greater interface with local service providers. So this characterizes generally specialty mental health probation programs across the country. One thing that the state of North Carolina was particularly innovative in, they are allowing us to add a clinical consultation with a licensed clinical social worker, and that's Andrea, who is joining me here on the call today. And what Andrea does, and she's happy to talk about this role when we get to the Q&A, but she basically meets monthly with each county where we have specialty mental health probation, meets with those officers and their chief to talk about difficult cases, to provide information, to talk about local providers, treatment options, and so forth. So that's an innovative feature that we've added to the specialty mental health probation model. And then also we have stakeholder engagement meetings. When we launch a new county, we'll bring together managed care organization, providers, the probation officers, other local law enforcement, whoever has involvement with serving individuals with mental illness. We'll bring those folks together to introduce everyone, to talk about our specialty mental health program, its purpose, allow the officers to introduce themselves, and then hopefully allow for networking to occur. Let me pause here for a moment and turn to Andrea. Andrea, is there anything I missed about your role as clinical consult, or just my general description of specialty mental health probation in North Carolina?
No, you captured it very well. And like you said, I'll be happy to take questions when we get to the question and answer portion.
Thank Okay, so now that we're doing in our current study that we're describing now is we've added an IPS team that is embedded within the probation setting. So this is a 1.5 FTE. We've got a full-time employment specialist and a team lead working directly with 4 specialty mental health probation officers to coordinate IPS services. So our 2 study counties, Durham, North Carolina, and Wake County, North Carolina, is where this is occurring. So we've got our IPS team interfacing with 2 officers in Durham and their chief, and 2 officers in Wake County and their chief. So they are working with whoever or whomever those officers in each county want to refer to the study. And I'll talk about the study. Now we've got an implementation effectiveness study to look at both the implementation and the outcomes of what happens when you add IPS to a specialty mental health probation setting. We're using qualitative methods to assess the implementation. So what does it look like when you try to integrate IPS in a probation setting? What are the challenges? What are the facilitators? What works well? What are some things to consider if this were to be more broadly disseminated? So we hope to be able to inform the field if others want to try this. We'll have some lessons learned with respect to challenges in implementation, and then also ways to have success. And then we're also conducting concurrently a randomized controlled trial. So as individuals on probation with mental illness get referred to the study and they're eligible, they provide informed consent, we are then randomly assigning them to either receive usual care, which means whatever a specialty mental health probation officer would do to provide resources for jobs, or randomly assign them to IPS. Our IPS specialist, once learning that someone has been assigned to the team, will make a phone contact immediately and then begin working. And as Kristen said, this is an employment first approach where our IPS team will work immediately with these probationers to try to get them jobs. So capitalizing on the information that Kristen provided us earlier, a number of these individuals need to work, and these are requirements, first and foremost, often that is a part of their probation. So telling someone without a severe and persistent mental illness to go out and get a job is one thing, but if you layer on the severe and persistent mental illness plus the justice involvement, a number of these individuals are coming out of prison, so there's often a felony conviction involved. It really complicates the ability to get someone employment. So the idea that we can combine IPS with specialty probation to get better outcomes for this really challenging group that really needs a lot of services was really the impetus behind this project. So let's go to the next slide. So we don't have results, obviously. We just started within the last several months. I believe actually we enrolled a couple of new folks into the study today. So our number there might be 16 individuals randomized. So we might have 8 to specialty mental health probation plus IPS and 8 to usual care. It took a while to get started, as many of us are experiencing. We had lots of delays due to COVID, so we've started slow, but we're picking up steam quickly. We have started our implementation portion of the study where we've conducted interviews with our IPS team. So we've learned a number of lessons just in the short time we've been doing this about integrating IPS into a probation setting. Differences in communication style, both on the side of probation and the expectations of an IPS team and how they communicate with other providers, particularly mental health providers in the community. So we've learned quite a bit about how those different sectors, criminal justice versus community services, communicate. Also the different orientation and mission, right? Probation, as we all know, their orientation and mission is to protect public safety first and foremost. They were never designed to be a direct service provider, although often they're called upon to provide services and well beyond their original mission. And then expectations, particularly on the IPS side, about how maybe probation might adapt to the integration of within that probation setting, have been things that we've learned so far. And I'm happy, again, Andrea and I are happy to talk more about these lessons in the Q&A session. Okay, so next slide. And then I would like to turn it back over to Demetrius.
Thanks, Gary, Andrea, and Kristen for your presentations. As Gary said, we are now entering the Q&A portion of the webinar. For this portion, again, if you have any questions that you would like either Kristen, Andrea, or Gary to answer, please put that at the chat at the bottom of your screens. We will then facilitate that question to them for them to respond to. So we do have a few questions that came in previously. One of the first questions, Andrea, I wanted to ask you, it's a very technical question, but you may have some best practices around this. But the question is, how many clients can a person with a full-time, 1 PO FTE have as an IPS specialist? How many cases can they manage?
Wow, that's an interesting question. Gary, I'm going to let you jump in here too. I really think it's going to be a low number, especially, and part of that is going to depend on the amount of resources that are in the neighborhood, so the availability of resources, and also it's going to depend on the challenges that the probationer may be facing. So the mental health challenges and their access to mental health services and that type of thing. Gary, please feel free to jump in here with that.
Sure. And I see another question there in the chat, which is good. So IPS stands for Individual Placement Support. So, and Kristen can weigh in and talk a little bit about this as well. So it's embellishments or additions to the supported employment model that really focus on employment first, similar to housing first. So IPS, let's get folks into employment right away. Let's do a career profile, figure out what kind of skills and abilities, what kind of job someone wants. And that happens concurrently with work in the community. So the IPS team works in the community to find employers who are willing to employ justice involved individuals with mental illness. So kind of working from several different angles, working with the consumer to find the right job, work with employers in the community, but then also work with a mental health provider, work with probation officers, so sort of serving as part of a larger treatment team. Back to the original question, so the IPS model with full fidelity, and Kristen, you can jump in and add to this as well, but it is generally 20 to 25 individuals on a caseload per 1.0 FTE. So with our 1.5 FTE IPS team, we'll be serving at any given time probably 20 to 25, maybe 30 at the upper end individuals at any given time. Now, if the question was about what is the caseload size for a specialty mental health probation officer, we're trying to limit that to 40 versus a regular probation officer might have 60 or 70 or 80. So we are limiting that to 40 because these individuals are so complex. And I've just gotten some information from the team lead on our IPS team who's on the call. So the fidelity requirements for a full-time supported employment specialist is 20, a caseload size of 20. Thank you, Matt, who's on the call.
Wonderful. Thanks, Gary and Andrea. I have another follow-up question that is, I'm going to kick it to Gary and Andrea. You may be able to follow up as well on this question. And the question is really around some specifics in the employment of the IPS program. The question is, does the IPS program, is it part of the behavioral health provider, or is that housed somewhere else in your program? So where does that function sit in how your program is designed?
Thank you. That's a great question. So our IPS team is housed within the Center of Excellence for Community Mental Health, which is an inpatient, outpatient mental health agency under the umbrella of the University of North Carolina. So the IPS team is embedded in a larger mental health agency. The mental health agency also has an ACT program. It's got a mental health court. It's got a bunch of other 18 other recovery-oriented services. So that's where the team sits. And then it interfaces with probation in Wake County and Durham County. So the team is supported by a larger agency. And if there's any follow-ups there, I'm happy to provide more information about that.
Thanks, Gary. I have a question for you, Kristen. A question is, and I'm going to be paraphrasing some of these questions, panelists as well as whoever asked the question. But Kristen, the question is, while it is true that folks with SSI can work, but isn't there some type of restrictions when they do work?
Yeah, it's an excellent question. So, and it requires sort of a complicated answer, and I'll get into the weeds just a little bit. So because SSI is a needs-based program, an individual's benefit check will be impacted by earnings from work, and it'll be impacted based on how much they're earning and how much they're earning each month. So the change in benefit amount can change each month as someone is working, depending on how much earned income and other unearned income from other benefit sources they might have coming in. But what Social Security has in place are a number of work incentive programs to help reduce the amount of the income that they count towards that benefit payment amount. So they have exclusions. The first $20 of earned or unearned income is excluded and not counted, doesn't impact the check. The next $65 that someone earns only from work is excluded, and then they only count $1 of every $2 earned towards the kind of reduction of your benefit check. And so, for example, if somebody worked and earned $500, so they're just working part-time earning about $500 a month. After all of the calculations are said and done, there will be a reduction in their SSI check of $132. $132 will be subtracted. So they'll still get an SSI check of $700, still be getting $500 from earning. All said and done, they'll have $1,200 at the end of the month. When before they were working, they only had $841 in SSI. And that's the 2022 number. So in 2 months, everyone's getting a raise. So you can see how the total amount of income went up from work, even though the benefit check was reduced. So kind of our mantra is work pays, and it does increase, the total income brought down. Now, if someone is able to work and earn at an even higher amount, they will eventually get to a level where their SSI benefit amount would go down to zero. And then in that case, there are other kind of protections for maintaining health insurance through Medicaid, things like that, that we can't get into now, but just to know that there is quite a lot of kind of monthly earnings that you would have to get to before you're down to zero in that benefit check. But at that point, awesome, because $841 in SSI isn't enough to live on. And so if someone is able to earn at a higher level, that's excellent.
Thanks, Kristen. One other question that I want to address to both Gary and Andrea, as well as you, Kristen, but I'm going to ask Gary and Andrea the question first. And it's around, I'm going to unpack it a bit. How do racial disparities in the system affect outcomes of programs like this one? I want to pack that a bit. Gary, I guess one of the questions that I have for you all is, in your survey, are you all looking at racial inequities or racial disparities at all in any of your data? And if not, do you have any, or can you suggest any data around this particular issue as it relates to supported employment and racial disparities in the overall system?
That's a great question. And in our study, we didn't set out to examine those issues, at least with this preliminary pilot. We're focused on, can this be implemented, and what kind of outcomes can we get in a small pilot study that would be information to inform a larger scale randomized trial. However, we'll have a diverse sample with our Durham and Wake County participants, and we would be able to examine sample power issues notwithstanding, but we should be able to examine differential impact along race and ethnicity with respect to our IPS randomized controlled trial. I'm not aware, although they're probably experts on the call in the participant list, and Kristen and Andrea, you might have some insights too. I'm not aware of data or information on the differential impact of IPS along racial ethnic lines at the moment, but it's certainly important to examine going forward.
Thanks, Gary.
Oh, sorry.
Yes,
Okay.
Yes.
I was just going to add, I was just doing kind of a quick search to see what other studies might be out there. And it looks like there are some. There was at least one that was published recently looking at the IPS model implementation in London. So it wasn't in the United States, but using that same model. And they found that there weren't significant differences between the proportions of people who gained employment when looking at Black, Asian, and minority ethnic communities is how they defined it in their study. I do think it's really important, and we'll continue to look up to see, what we're looking at here. But I think that when we, think about our services in general and folks' access to those services, access to treatment and supports has definitely been disproportionately unavailable to BIPOC communities. And so I do think that it has to be something that our programs take a close eye to. Like, are we disproportionately underserving certain groups? And if we are, actively addressing that and working against that trend, which is something that we see in our services and need to identify. So I say that we see in our services in a general time, not like talking about any particular one, but something that we see.
And to build on that real quickly, and again, thanks to DOJ for funding our study, recognizing the disproportionate number of people of color in the justice system. You know, you layer on that plus the severe mental illness, and it makes it even harder for these individuals to get jobs. So we're not aware of studies that have really focused on the justice involved population for delivering IPS services. So this was important for our team to be able to do, again, with generous funding from DOJ to really start to address these issues among people of color who are justice involved, who have severe mental illnesses. Andrea, anything to add on that?
I was going to just piggyback on what Kristen said and then what you just said and say that, you know, what we know is that there are, you know, this is a microcosm of what occurs in society, and we know the challenges that are faced by racialized populations. And so we are grateful that, you know, we're able to do this investigation so that we can then begin to identify, you know, how we might meet those challenges.
Thanks, everyone. Andrea, I know you just got finished answering a question, but I'm going to kick this question to you because I think it's probably well suited for you. It's another question about the North Carolina IPS program, and the participant wants to know whether that program works with the VR in their employment and benefits counselors.
Right, and Gary, you jump in here as well. Our program definitely works with all of the resources that are available. Our specialist has been successful in finding employment for probationers, and she's been able to do that, you know, on her own, working with the mental health resources and working with probation officers. Gary, do you want to add anything else about the other resources or people that she's worked with?
That's exactly right. And another thing, our team lead, Matt Deal, who is on the participant list and is a national expert at IPS, he has worked, and he's our team lead. So he's worked with our local managed care organization to set up Medicaid billing for those folks who Medicaid involved in our project, but then also with some state funds to begin to try to generate revenue. The idea here is to make connections with VR, to make connections with our local managed care organization, so positions like the supported employment specialist can begin to be generate its own revenue, so we can do the service and sustain the service beyond our grant funding. So as Andrea said, VR is a viable resource that we're accessing, and then also working directly with our MCO to figure out how can we bill for this service for those folks who are also on Medicaid, or for those folks who are waiting to get Medicaid and benefits.
We also had another question, and I wasn't sure if this question was specifically about IPS or supported employment and or both, but I think I'll ask Kristen as well as you, Gary, in terms of your staffing. Does your staffing, and what do you feel about staffing, including peer support specialists, in the work that you're doing in North Carolina, specifically, Gary? And Kristen, what are just your thoughts in including peer support specialists in servicing folks through any SE services program? Gary, I'll start with you.
That's a great question. And yes, so in North Carolina, we have about 38 IPS teams. Now, these are teams across the state that aren't connected to specialty probation like I've described here. But I'm bringing that up because those teams do have peer support specialists. So that's a very, very much a part, as Kristen, I'm sure will tell us as well, that's very much a part of the model. With our specialty mental health probation IPS team, we do not yet have a peer support specialist on the team, although that's an intent of ours. I'm not sure, due to some timing issues and delays with COVID, that we'll be able to engage with a peer support specialist just yet. But as we think about expanding our IPS / especially mental health probation model, a peer support specialist would absolutely be a part of that going forward. And then let me turn it over to Kristen for more about that.
Sure. I mean, I would just confirm that, yes, absolutely. I mean, peer support workers and specialists are absolutely, key to the implementation of this work, and so much work when people can hear from others who have gone through the process, who can engage with and build rapport, share their own success, their own challenges that they've been able to overcome, and kind of share that experience is invaluable to the process. So yes.
Thanks, Kristen. We have about 25 minutes remaining. So I just want us to have some time to go through the discussion portion. So Eunice, if you can just go to the next slide for me. And so we are now entering the discussion portion. And for the discussion portion, we created some prompted questions that's on the next slide, particularly for those who are thinking about or looking to form and have an SE. And we wanted you all to have an opportunity to ask questions, brainstorm, discuss, think, just have a free-flowing conversation about some of these questions and what you're looking to do in terms of your SE work, and just to be able to have the experts on the line to be able to respond to some of the ways you're thinking about your program. For this portion, we're going to actually go live. So I'm going to ask at the bottom of your screen if you can just raise your hand if you have a comment or question or thought about the questions on the next slide. And Eunice, if you can just go to those slides for us now. If you have a question, thought, feeling about any of these questions, then raise your hand. Once you raise your hand, we'll acknowledge it, take you off from mute, and then feel free to ask your question in real time. So let's get started. Kristen, I'm going to pass this over to you. Feel free to close any gaps that I may have said in presenting and moving forward on this slide.
Thanks. You set it up really well. So we just want to kind of hear from you all, hear from your lessons learned. What are you doing? What has been successful in your program? What things are you concerned about? All of that. So we just put some together some prompts to kind of get that discussion going. Whether or not your program currently encourages supported employment, if you've had success with those referrals, and then if you kind of think to yourselves about your own programs and what you've kind of learned today, what you think could be some of the benefits or challenges to incorporating supported employment into your program. And then related to that, what do some of those client discussions about employment look like? How do they go? Are your programs connected to employment services, or are you still looking to kind of make that sort of outreach? And then in kind of that self-reflection of your program, what portion of the individuals you serve need to or are applying for disability benefits or looking for employment. So this is kind of setting us up for the discussion, but wanted to see, raise your hand so that we can unmute your mic. So that's the only way we'll be able to hear you, is if you raise your hand, and then Joel will help to unmute your line and tell us about supported employment within your programs. What's that look like?
And if I could, it may also, Andrea or Gary, it may also be beneficial for folks to hear what some of your experience and responses are to these questions, given the work that you all are doing in North Carolina. I would particularly be really useful to hear and would like to hear some of the benefits or challenges you all have been experiencing. I think some of the folks on the webinar may also benefit from that as well. Not to put you all on the spot, but I think it'll be great to hear from you all.
We have a hand raised from P Small, and I've unmuted you. Yes, I am Palestine Small, and I work for the local Reentry Council here in Durham, North Carolina. And so our basic criteria is that you have to have had some justice involvement. And there's really no timeline, as in beginning and end of program. We just work with individuals until they reach the goals that we have set before them. So, or the goals that they have decided for themselves, I'm sorry. But we do kind of encourage them. So what I wanted to say is I think some benefits would be, especially for the case management that we do here at the local Reentry Council, is that I find when individuals come out of incarceration, if they have already purposed in their mind that they're going to get a job and they want to be successful, it seems easier to assist those individuals because they're more likely to take the ball and run with it. So when we refer them to supportive employment agencies, like Ticket to Work in VR, and they get a case manager there, we hear such good news. And on the other hand, we have some individuals who may not have the benefit of a counselor, whether it's a mental health substance use counselor or a general guidance counselor while incarcerated. And so they come out kind of with the attitude unchanged. So they come here because their probation says that they have to come, but sometimes they're not serious about the change in trying to get employment, which usually leads to recidivism. So one of the things I wanted to ask was how do you guys kind of handle that challenge? Because you have this group on the right that's going to be successful, got the mind made up, want to engage in supportive employment. You give them the information, they go to the wherever they're going to get that supportive employment from, and they do well. Then you have this group on the left. Oh, I just came here because my probation officer told me to. So sometimes the attitudes haven't always changed. And so I know that communication, engagement, positive affirmations and the things that we speak to them and how we try to encourage them is important. But what are some other tools that you guys might use to kind of help with that? Whether it's visual, written, or how do you kind of handle that?
So I wanna open that question out to all of the panelists. Just how do you move along individuals in terms of challenges? How do you move along individuals who may not, immediately where they are, who may not be wanting to freely and actively participate? So I do want to open that up to the panelists to respond to first. However, I want to make this as interactive and a group discussion as possible. So if there are, and I see people chatting, right? So if there are others who are participating who have some specific feedbacks or answers to questions, and sorry, Crystal, not to put you on the spot, but Crystal just chatted motivational interviewing, right? So if there's folks after the panelists and presenters speak or answer a question, feel free to raise your hand and Joel will unmute you, and you can also respond to questions because we're looking to make this as free-flowing and thought-provoking as possible. So everyone should feel free to chime in. So I'm going to kick that open to the panelists, Gary, Andrea, Kristen, and then open it up to other participants as well.
Absolutely. Thanks so much. Kristen, you can go ahead. I didn't mean to.
Oh, no, please, you.
Yeah. So one of the things that, I would say, and thanks so much for your question, Ms. Small. One of the things I would say is, it is definitely about, we use this cliche of meeting the probationer where they are, and sometimes they may not even be able to envision themselves in getting a job and being able to keep a job. And so sometimes it is starting all the way back there where you convince them that they are employable and that they can, take what they have. They can manage the symptoms of their mental illness. And sometimes it might be about, that extra encouragement to seek mental health treatment if that is something that they are also engaged in, to follow through with that. But I would say it is about, that cliche just comes back again and again, and that is meeting that person where they are, looking at the systemic challenges that are around in terms of transportation, in terms of, Are they someone that you might need to write down all the great instructions that you're giving, because by the time they leave the door of your office, they've forgotten those things. And so, all of those little things, I think, are the combination of things that might make one person successful because they come in with the agency and the ability to handle it, whereas another person may need some small incremental kind of steps to get to that place. Others?
Well, Andrea, I think you were spot on. The only thing I would add is like those peer support workers we were just talking about can play such an important role with folks who are feeling, trepidation or, wariness about kind of pursuing employment, and seeing someone who has kind of gone through that can really tell their own story makes a huge difference.
And Demetrius, aligned with your wish to make this interactive, the team lead, Matt Deal, for the IPS team that's working with specialty mental health probation is on the call. And this would be a great opportunity for Matt to talk directly to the question that was raised. Matt, if you're willing to do so. And you can find Matt and maybe unmute him.
Hey, Gary and all. I didn't intend to interrupt the presentation at all or join the conversation. I was just trying to respond to some of the questions. So I appreciated the initial question about, people's motivation and the recommendation about trying to utilize motivational interviewing. I think another challenge and issue that we face is that we have limited access to resources. Typically, access to vocational services is a very slow process. And I think one of the things that I am hopeful about in this project is, the IPS model that, as Kristen has shared, is designed to move rapidly and quickly to help capitalize on people's motivation and to show them that this is a different approach to service provision. And that if we're able to pull this project together and have the IPS team, the specialty mental health probation officers, and the treatment providers, and perhaps even vocational rehabilitation sort of working together to help provide employment services to people and treatment services to people, we're probably going to see some pretty interesting findings, is what I hope we're going to see. So I do understand that it's probably pretty clear that people that come out motivated are more likely to be successful, but I think people have also been let down by the service system for a long time, and they might not have a lot of hope or belief that things are going to be different this time. And maybe we need to do a better job as service providers of engagement, and again, getting people to see that there are different ways to do things. And that's why, again, I think this is such an exciting project, and I'll be quiet now.
Thank you, Matt. Not at all. No, you're not interrupting, and glad you're here and able to contribute.
Yeah, no, Matt, definitely. We definitely appreciate your expertise. So feel free to jump in, and know you were told wrong if you didn't think that you were going to be able to participate in this, because we want to make these webinars as interactive as possible. So definitely appreciate your joining the conversation. I think there were a few other people, Joel, who may have raised their hands. So I just want to give them an opportunity to speak.
Yes, Shadiqua Smith, John McGon, and Stephanie Gatewood have raised their hands.
Hi, this is Shadiqua Smith. Can you hear me okay?
Yep, we can hear you.
So I just want to echo everything that has been said in terms of motivational interviewing and the use of peer support. And also sometimes it's just as basic as asking why. Why don't you want to work? Why aren't you motivated to work? And sometimes with that simple question, you're able to identify barriers that the individual has. And if you can work with them on overcoming those barriers, then you can start to move them towards being more motivated and hopeful about their employment outcomes. And that's all I have to say.
Thanks so much, Shaniqua. Really appreciate it. The next person.
Hi, this is John McGann. My question is, how are you engaging employers to hire the to hire these folks? What strategies are you using to get employers on board?
Again, maybe same structure, have the speaker panelists answer it, and then any other attendees or participants who have some thoughts to John's question, which I think is a really great one. That's when the rubber hits the proverbial road, to respond to his question. Again, is how are you engaging and working with employers to potentially hire someone who is reentering the community?
I'm happy to start.
Do you want to answer first, or whomever? I'm sorry.
Yeah, no, it's okay. I can start. Others can add on. So, job development is it is hard work. It takes skilled folks to do it. But when you've got good job developers in a supported employment program, it's wonderful. So it's all about engagement. It's talking to that employer about the benefit of hiring individuals, of not only kind of serving your complete community by having an inclusive workplace, but knowing that they're coming into that work with support, right? There's a supported employment specialist or a job coach who might be there to help support that person in their employment. And, the rest of us, we don't, come with that support, right? So this is like an additional benefit that comes to the employer. There's, of course, all of the other really tangible benefits that employers have if they get tax benefits for employing individuals with disabilities. So there's that element as well. But it's about relationship building. It's that same, sort of engagement that we're doing with the individual around employment. It's doing that with, employers in the community about, why this is good for them, good for the their organization, their business, all of that.
I'm an ivory tower researcher, so I don't have on the ground experience. Now there's a couple of comments in the chat that partially answer or provide some answers to your question, John, but also I'm going to lean back on Matt Deal, who's been doing supported employment IPS for a while. Matt, if you're willing and able, what response would you have about engaging local employers?
Can you hear me?
Yep.
Okay. So I think Kristen alluded to the job development aspect. It's one of the principles of the service. So there's an expectation that the employment specialist, especially the employment specialist working on this project, is doing community engagement, job development, networking with employers on behalf of the folks that have been referred to work with her. So it's a big part of the job. It is not always, again, easy to sell this to employers. However, there's a belief that when a good ongoing relationship can be developed between the IPS team member, the employment specialist, and the person at the employer who's involved in the hiring process, that there's a certain level of trust that gets built up, and that it's actually a service to the employer too. If the IPS team is able to bring a good employee who can meet the needs of the employer to them, that's not something they can get necessarily if they're hiring off the street. There's no guarantees. Kristen mentioned some of the incentives. There's a federal bonding program through what used to be known the Employment Security Commission as a way to provide some insurance to a potential employer. But a lot of it is, it's the networking. It's the relationships that the IPS team builds with people who have hiring authority, and that trust. And then also there's an ongoing level of support. So it's not just a placement service. If the individual receiving services is open to the IPS team being involved with the employer, the employment specialist can come on site, can do job coaching, can help have conversations with the supervisor and the individual if there are some communication issues or somebody's not showing up for work. So that time unlimited follow along support is another way I think that trust and rapport can be built with employers. But it's not easy. And by doing that all the time, we tend to find out who are the employers that are willing and able to hire individuals that might have a criminal background as well. So there's a lot of pieces to that.
Thanks, Matt. And you're now getting questions in the chat, which is terrific. So comparing and contrasting IPS with VR services, the question to you, Matt, is what makes vocational rehab, that process maybe a little slower? Is it workforce development training, establishing eligibility? Is it paperwork, waiting on funding maybe? What are some of the insights that you have that maybe makes the IPS process a little quicker maybe than traditional VR?
Sure. So there are several pieces to that as well. Typically, vocational rehabilitation counselors have incredibly large caseloads, typically over 100 individuals. It's a paper-heavy process that they do. There's also, I think, more of a assess, and then place approach, whereas in IPS, I think like Kristen was saying, and I think you shared, it's sort of following that housing first model, where we're saying that if somebody who is eligible for service has expressed an interest in working, we hit the ground running. We are doing job development on their behalf, typically within the first 30 days of them coming into service. And I think the VR process is, again, there's a pretty lengthy eligibility process that's involved, acquisition of a lot of medical records. There's typically a bit of time involved in their plan development. And if that drags on for several months, again, if people are ambivalent or not very confident, or they don't have a lot of support, they're very likely to fall out of service. So I think some of it is process, some of it is caseload size, and some of it is, quite frankly, that this is a group of people that a lot of professionals don't feel all that confident in, right? So if there's an expectation that I'm going to write a plan and this person has to succeed, people with SPMI and justice involvement and co-occurring substance use disorders, this is a population that isn't always very simple or easy to serve. And I think that plays a role as well.
Thank you, Matt.
Yes, thanks, Matt. Thanks, Gary. So we have about 3 minutes remaining. We have a few more slides that are just high-level closeouts. So if you have any other follow-up questions or responses to what has been said, any of the questions that we have here, please raise your hand so we can call on you now before we wrap up in the next 3 minutes. No? Okay, cool. So Gary, Andrea, Kristen, do you all have any final thoughts or any other thing you want to say before we move on that may have jogged your memory, have jogged or close out for any of the discussion questions or what's come up during the discussion? No, okay, we're good. All right, so next slide. Again, this next slide is just resources slides that we provided. I'll drop the remaining resources that we have in the chat, but again, you all will be, just so that you can have them now immediately after. Oh wait, we go back. Stephanie, I think someone else raised their hand. Stephanie. Stephanie, are you there?
Yes, I am. Sorry. I think you forgot me in the last round of speaking. I just wanted to reiterate the fact that we have a pre and post release program where we actually start the relationship while they are incarcerated, and we remove all the language or all the barriers that the free world uses, such as criminals or criminal records. We don't even use the criminal record piece, in as much as we use justice involved or people who have a history of background. One of the other initiatives that we have recently delved into is the fact that we can offer them letters of employability, which that letter of employability just really takes them back to the court to show, for the judge to say, hey, this is an upstanding citizen now, they've done their time. We have character witnesses that agree. And it's almost like a bonding program, but it's just an extra step that is taken. And employers seem to really, really like the fact that we've done that extra work to be able to have them to be employed again. And so that's the piece that I think has been successful.
Thanks, Stephanie. Definitely thanks for sharing, and I'm glad we had time to back up. As you will see, and as I started to say, I'm now going to drop some of the resources in the chat just so that you can have those resources now, although you all will be getting a copy of this PowerPoint presentation in the next week or so. But here are the resources that both Kristen discussed at the beginning of the webinar that can help and provide support to you all as you begin to think through and continue to develop, hopefully, your programs with SE services. Next slide. And here is the contact information for all of our speaker and panelists. Again, they have graciously provided their contact information. So if you had a question or had some follow-up, I think because they gave me their address to include here, you should feel free to reach out to them if you have any further follow-up. Now, I should say to them, this seems like a very talkative group, so you all may get a lot of emails, but it's too late now because you've already provided your contact information. So we're going to have folks run with that. So here's the contact information here. If you can just leave this for a few seconds, Eunice, so that folks, if they can just write contact emails down. Okay, and then finally, the next slide at a minute over. If you haven't done so already, we really encourage you to join the CSU Justice Center newsletter listserv. Not only is it a great way to learn about funding opportunities such as the JMHCP TTA grant, but you will also receive information on upcoming trainings and resources from our agency and partners. I also want to remind folks that this webinar has been recorded and will be posted along with the PowerPoint slide deck on the CSU Justice Center website's event page. So once that goes, all of the attendees, and you should feel free to circulate that information to your networks as you see appropriate. And then finally, thank you everyone for joining this webinar. And we want you all to have a great rest of your day. And I want to give a specific thank you to Kristen, Gary, Andrea, and our ad hoc panelists, Matt, for jumping in. We really appreciate all of their expertise, as well as you all, the participants, for all your interaction and engagement during the Q&A, as well as the discussion portion. So thank you, everyone, and have a great day.